Sleep apnea is a condition in which people stop breathing, and they stop breathing about every 1 to 2 minutes. It's a condition which is found in all age groups. We see it in children, we see it in adults, and we see it in the elderly. The main symptom that we see in sleep apnea is daytime sleepiness. And the reason why these patients are sleepy is that every single time they try to sleep, their breathing stops, and in order to start again, their brain wakes up. The most important risk factors, being overweight, being male, having hypertension makes the patient much more likely to have sleep apnea. Sleep apnea requires a visit to the doctor in order to decide what to do next. That'll usually involve a test. The test can be done in a laboratory such as ours here, or it can actually be done at home. The most common treatments that we use involve CPAP devices, which stands for continuous positive airway pressure, and it keeps the breathing passage open. Some patients will do well with a dental appliance that they wear at night, and more rarely we will recommend surgery. And the most revolutionary surgery that we can offer patients is basically to stimulate the nerve that goes to their tongue, which pushes it forward, which in many cases can actually get rid of the sleep apnea. Many patients with sleep apnea, for example, especially women, may have symptoms of depression and are often misdiagnosed as having depression when all they are is sleepy and they require treatment for that. I can recall a patient who had narcolepsy, a condition where they have overwhelming sleepiness almost all the time, plus other symptoms, and she was failing at school. And finally, when she was diagnosed and she was treated, I first saw her when she was about 14 years old. She did extraordinarily well. She went through high school, and the last that I heard, she was a medical student and doing extremely well. I'm Mayor Krieger, professor of pulmonary critical care and sleep medicine at Yale Medicine.